If we compare your blood vessels to a continuously flowing stream, then blood clots are like unwelcome debris, mud and stones, that obstruct the smooth circulation of blood. Clots can form in vessels throughout the body, whether in the brain, heart, or limbs, and once a vessel is blocked, the resulting reduced blood supply can compromise organ function or even become life-threatening. This guide will walk you through the mechanisms behind blood clot formation and offer fresh examples and practical advice to help you gain proper insight, prevent blood clots with a science-based approach, and ensure your life's current keeps flowing freely. 1. Endothelial damage, the root of clot formation. Under normal conditions, the inner walls of your blood vessels are smooth and elastic, like a well-maintained roadway. However, factors such as high blood pressure, elevated cholesterol levels, and long-term smoking can damage the endothelial lining, causing tiny pits and cracks. This damaged layer loses its natural protective barrier and becomes a fertile bed for the deposition of fats and cholesterol. For example, Mr. Michael ignored managing his blood pressure and continued smoking for years. Over time, his blood vessel walls developed numerous microscopic injuries. Low-density lipoproteins and triglycerides began to accumulate at these weak spots, forming unstable plaques. Once a plaque ruptures, it triggers a rapid response from platelets and clotting factors, eventually leading to the formation of a dangerous clot that can precipitate serious cardiovascular or cerebrovascular events. 2. Blood stasis, when slow flow leads to clotting. Blood normally flows at an optimal speed to ensure nutrient and oxygen delivery. However, a lack of physical activity, prolonged sitting, or extended bed rest slows blood flow, creating the perfect conditions for clotting factors to accumulate and form clots. Take the case of Mrs. Emily, who spent long hours sitting at work and rarely exercised after returning home. During a routine checkup, her doctor observed reduced blood flow in her lower extremities, putting her at risk for venous thrombosis. Following her physician's advice, Mrs. Emily began taking daily walks and performing simple leg exercises, which gradually improved her circulation and significantly lowered her risk of clot formation. 3. Altered blood composition, the hidden risk of clotting factor imbalances. In addition to endothelial damage and slow blood flow, imbalances in blood components can also upset the delicate equilibrium of the clotting system. Surgeries, injuries, or certain chronic conditions may lead to an abnormal increase in platelets and clotting factors, causing the blood to become hypercoagulable. For instance, after undergoing stomach surgery, Mr. David experienced restricted mobility during the recovery period. Combined with the stress response from the surgery, his blood became unusually viscous. Under his doctor's supervision, he not only adjusted his medication but also incorporated light exercise into his recovery plan, effectively reducing the likelihood of additional blood clot formation. 4. The impact of blood clots on different body systems. Once a blood clot forms, its effects vary depending on the location of the blockage. Brain risks, a clot within the brain's blood vessels, or one that breaks free and lodges there, can lead to an ischemic stroke. Patients may experience one-sided weakness, slurred speech, and in severe cases, permanent disability. Cardiac threats, clots in the coronary arteries can obstruct blood flow to the heart muscle, triggering a heart attack or angina. For example, Mrs. Sarah experienced chest tightness and brief dizziness. Upon examination, her doctors discovered significant narrowing of her coronary arteries linked to clot formation, leading her to undergo early interventional treatment. Pulmonary dangers, a clot originating in the deep veins of the legs can travel through the bloodstream and block a pulmonary artery, causing a pulmonary embolism that poses a direct threat to breathing. Mr. Robert, a sedentary office worker, suddenly experienced shortness of breath and was rushed to the emergency room, where he was diagnosed with pulmonary embolism. Prompt treatment saved his life. Risks to limbs and other organs, clots may also occur in the arteries supplying the limbs, leading to tissue death from inadequate oxygen supply. Should a clot lodge in critical vessels supplying the eyes or kidneys, irreversible damage to those organs may occur. 5. Comprehensive strategies for preventing blood clots. While blood clots are alarming, they can be effectively prevented and managed through a range of lifestyle adaptations and preventive measures. Here are several proven strategies. 1. Embrace a healthy diet. A balanced diet forms the cornerstone of blood clot prevention. Focus on consuming foods that are low in fat and high in fiber, such as fish, shrimp, whole grains, legumes, and a variety of fresh fruits and vegetables. Avoid foods rich in unhealthy fats, sugars, and oils, which can increase blood viscosity and promote clot formation. Additionally, ensure you stay well hydrated by drinking water frequently throughout the day. This practice helps dilute the blood and supports efficient metabolism. 2. Quit smoking and limit alcohol consumption. Tobacco smoke contains substances that damage the vascular endothelium and promote inflammatory responses and lipid deposition, accelerating arterial hardening. Excessive alcohol intake may cause vasospasm and elevate blood pressure, further straining the cardiovascular system. For example, young Andrew struggled with a smoking habit and heavy weekend drinking. With the support of his family, he gradually gave up smoking and moderated his alcohol intake. Over time, his blood pressure stabilized, and his overall cardiovascular risk diminished considerably. 3. Engage in regular exercise. Moderate, routine physical activity is one of the most effective ways to strengthen heart and lung function and promote circulation. Activities such as walking, jogging, swimming, cycling, and practicing Tai Chi help keep the blood moving steadily. For those with limited mobility, a cared for passive exercise like ankle pumps or gentle leg massages can also aid circulation. Mrs. Laura, for instance, started doing 15 minutes of indoor exercises each day as recommended by her doctor, which markedly reduced her risk of developing venous clots. 4. Maintain a regular sleep schedule and manage stress. Sleep deprivation and chronic stress can adversely affect your body's hormonal balance and contribute to cardiovascular issues. Aim for a full night's sleep and adopt a routine that supports early bedtime and waking up at the same time each day. Additionally, techniques such as yoga, meditation, or listening to soothing music can help alleviate stress and lower the risk of clot formation by promoting overall relaxation. 5. Undergo regular checkups and use medications wisely. For individuals with underlying conditions like high cholesterol, high blood pressure, or diabetes, strict management of these disorders is essential. Follow your doctor's instructions regarding medications that lower lipids, blood pressure, or inhibit coagulation. High-risk individuals might even benefit from annual vascular ultrasound screenings to detect early signs of blockage. For example, Mr. Stephen, after ignoring routine checkups and developing localized clots, learned the hard way. Since then, he has maintained yearly examinations and remained on a prescribed medication regimen, successfully averting further complications. 6. Adopt an active lifestyle, building a robust defense against clots. Preventing blood clots is not solely about individual actions, it's about cultivating a comprehensive, healthy lifestyle. Changing detrimental habits, regulating your daily activities, and maintaining an overall balanced routine all contribute to a powerful prevention strategy. Whether you're a busy professional or enjoying retirement, it's crucial to recognize the risks that blood clots pose and commit to proactive measures that safeguard your vascular health. As Mrs. Jennifer wisely puts it, adopting a healthier lifestyle not only kept clots at bay but also brought more energy and joy into my everyday life. By integrating these multiple strategies, healthy eating, quitting smoking, regular exercise, proper sleep and stress management, and routine medical checkups, you can significantly reduce your risk of blood clot formation. Remember, a healthy lifestyle isn't just the best defense against clots, it's the most reliable insurance for your long-term well-being. Take charge today, Don't let harmful deposits in your vessels block your life's flow, and protect yourself against the dangers of blood clots. Finally, may every individual approach their health with a scientific mindset, actively prevent clots, and build an unbreakable shield of wellness for themselves and their loved ones. Begin your journey toward a worry-free and vibrant life by making informed decisions that keep your blood vessels clear and your life running smoothly. Feel free to explore additional topics on lifestyle changes, nutritional advice, and specialized medical interventions as you continue on your path to optimal vascular health. Enjoy the benefits of a clear, unobstructed life, where every beat of your heart is celebrated, and every drop of blood flows freely.